here today to talk about vaccine access and equity issues, as well as several programs that the town of Nantucket is operating to make vaccine access easier and more comfortable for everyone involved. So at the moment, we have several initiatives for vaccine access. For anyone who is unable, due to time or language issues, to get in touch with the open scheduling system the Nantucket Cottage Hospital is using, you can email me at my email address, and then I will connect you with volunteers who will get you signed up for the vaccine. Additionally, the town of Nantucket will be launching pop-up clinics and walk-in clinics at a variety of locations, most likely starting from early to mid next week. And then we will also be doing mobile pop-up clinics and outreach and education activities scheduled for a variety of different locations, aimed to relax people's hesitancy around the vaccine, to share stories about people who have been vaccinated, and to kind of reassure people who may be questioning whether or not the vaccine is the right choice for them. So at the moment, the primary method for vaccine access and outreach has been business targeted. So if you are a business owner or if you work for a company, you should have either yourself or your boss get in touch with me at my email again. And when you email me, I'll reach back out and we'll start scheduling a clinic. Any number of people, any number of places. We'll do our best to make it as convenient for your workforces to get vaccinated in a timely manner, so that we can have a pretty solid vaccination rate amongst the most at-risk population before we get really rolling into summer. Additionally, the pop-up clinics are going to be kind of locally targeted. So we'll have outreach efforts to connect us to a variety of local businesses. We'll sort of set up shop around there. We'll have some experts, some interpreters, some testimonials from people who have had the vaccine and can talk about what it's been. We'll let everyone get good and comfortable and sort of examine the best information and data about how the vaccine impacts them and whether or not the vaccine is the right choice. And then now that the town is going to be having its own independent supply of vaccine that we've sourced, we'll be able to set up an opportunity to get vaccinated right after if you'd like to. We're planning on having these outreach activities be ongoing for a decent chunk of the summer, and we're trying to make it basically as close to effortless as possible to get a vaccine. So basically, the walk-in clinics will be held regularly, once, maybe twice a week. You'll just go to the place that we are setting up. You'll say, I want a vaccine. We'll give you your vaccine, and you'll be on your way. Additionally, the offsite or the mobile clinics, we're going to have something that I at least like to call the Vax Wagon, where we're just going to drive around, see if people need vaccines, set up a clinic, observe them after we inject them, get them all entered into the immunization database, and send them on their way. So that's basically the several parts of our outreach program. Initially, we're going to be working to remove as many barriers to access as possible. There'll be no scheduling component, there'll be no pre-registration. It'll just be show up at this time and this place, and you'll be able to get your vaccine. And then we're also going to be working to educate and sort of ameliorate people's concerns about the vaccine, because there are a lot of, this is a medicine that didn't exist a year ago. So people's consternation or concern about it is understandable. So we'll be sharing all the best information that we have available, all of the studies. We'll be finding, the easiest and most effective ways to explain the value of getting vaccinated, both for yourself and for your community. So it's not it's going to be a process. People have very good reasons for being hesitant about the vaccine. We're certainly going to try and address those concerns as efficiently as possible. I myself have been vaccinated. I got Pfizer fairly early in the process when we were doing homebound vaccinations. And I can tell personally for me, I didn't have particularly large amounts of reaction. I felt a bit groggy the next day for a little bit, and then that was mostly it. And additionally, I wanted to take a quick moment to discuss the change in the mask order that the Board of Health for the Town of Nantucket just recently approved. So the mask order was adjusted to remove a single word, basically. So all of the mask ordinances are exactly the same, except the word outdoor has been removed from the local town order. What this means is that if you can socially distance and you are outside, then you do not need to wear a mask. But if you are going to be consistently within 6 feet, the ordinance still stands as requiring mask coverage. So basically, as long as you're consistently away from other people by at least 6 feet, or if you're on a public bike path or trail, you do not need to wear a mask. But just as you need to wear shirts and shoes and pants to go into any restaurant or any store, you must wear a mask in any public indoor place.